So I'm really excited to be here, and I'm so excited to see so many people I know and people I don't know, and I'm hoping to meet over the course of this 2 days. We have a really busy 2 days, and it's happened so quickly, and it's just great that we're here to do it. So thank you for coming. You know, the theme of this conference is really academic community partnerships. And the purpose is to address the needs of Latinos in our region through action-oriented research. So I'm interested in research that is going to be impactful, that is going to improve the health of the Latino communities in our region, and that we're going to, do that through some respectful and mutually beneficial research between academic and community partners. We have 3 themes today: behavioral and mental health, health policy, and then chronic conditions such as diabetes and also aging. So just to give you an orientation there. So there's a thought process behind this conference, and I wanted to share it with you. We're not just here to meet and gather, which is a great thing to do and meet each other, but we really want to produce some products that are going to be helpful going forward. And the idea here is there's some process to the conference, there are some outcomes, and then there will be dissemination. We're going to have keynote presentations that are going to provide background information and sort of ground us in some ideas that then we can take into breakout sessions along the 3 themes that I mentioned. And in those breakout sessions, we're going to meet, discuss, and identify opportunities for research, priorities, what are the key issues that need to be addressed, and then try to identify potential collaborations. So one of the characteristics of academics is we move around. Even those of us, I'm actually from Seattle, but there are many Latino faculty who are not from our area, who come to the University of Washington. It's hard for them to connect with the community. It takes a lot of time. And so what we're trying to do is accelerate that process by providing a meeting point. One of the things we discovered in talking to people in our community through our work with the ITHS was that there aren't many focal points where academics who are interested in Latino health research and community members can intersect. And so we want to provide that forum. So in those breakout sessions, we're going to record the information that's discussed. We're going to then go back, organize it, and create proceedings. And that document will be available to us, all of us, in the community and in academic settings, and can provide motivation for applications to the NIH. So this conference couldn't happen without support from many different places. And so here's just some of the support we've received for making this possible. And I really want to thank our sponsors because they have had the goodwill and insight to help this conference happen, starting with the NIH with a grant that we received through the Institute for Minority Health and Health Disparities, Group Health Research Institute, where I have been a faculty member, the University of Washington Translational Health Sciences Program, ITHS, which is here, and then these others, the Group Health Foundation, the new University of Washington Latino Health Center that you'll hear about soon, and then Group Health Cooperative, the University of Washington Diversity Research Institute, and Fred Hutchinson Cancer Research Center. I want to acknowledge some very special people that have helped us prepare for this conference. Gino Aisenberg, who's going to speak to us in just a moment, Luis Fraga, myself, India Ornales, Jesus Reyna, Rudy Rodriguez, and Betty Thompson. And then there's some really special individuals who actually did all the hard work here. So I want to make an emphasis. Lisa Temposky has been wonderful. The project manager, you probably received many emails from her, and she's been absolutely great. And Megan as well. So Megan Addis is the person who you've seen running around helping us get organized this morning. Caitlin O'Connell has assisted us, and finally but not least, Nora. So Nora brings us together, and thank goodness for her work. Without her, this wouldn't have happened. There's a number of stakeholders on the stakeholder committee members. I'm not going to go through their names, but at least I wanted to flash them up here because I want to make sure they're recognized. So a little orientation for today. We're going to start, we have a very busy agenda. We're going to start with some keynotes that are going to really talk about the idea of this academic community partnership. And I think community-based participatory research is kind of the academic bucket, I think, where this kind of work falls into. And so we're going to have some orientation from experts and also a community perspective on what works in terms of research and when you're talking about academic community partnerships. Then we go into one of our themes with behavioral and mental health keynotes. We're going to have a breakout sessions on behavioral and mental health, lunch, a health policy panel, a breakout session again, and then a reception. And Gino will talk a little bit more about that. A few details, please silence your electronic devices, like they say in the theaters. Food is not allowed in this auditorium, so please, if you're going to eat, do so outside. We're going to be video taping these conferences and breakout sessions, so you're aware. And we're going to have a time for questions at the end of each talk. So please hold your questions until then. There is media present, both in the conference and at the reception. So don't be surprised if someone approaches you. One important note, the parking in this building closes at 5:30. So if you have a car here, be aware of that. Don't leave it here. And please provide us with your evaluations of the conference, because we need those in order to continue doing this in the future. And that's where I'm going to stop. So I'm going to introduce our two next speakers, Gino Eisenberg, who is my compatriot in this in making this conference happen. He's a mental health researcher at the University of Washington School of Social Work. His interests focus on three areas: traumatic exposure of children and families to community violence and associated post-traumatic stress disorder, depression care for adults, and evidence-based practice. Gino's also the Associate Dean for the Graduate School to provide leadership in promoting diversity and community partnerships. He is also a co-director of the newly established Latino Health Center. And secondly, I'm Dr. Mary Disis, who's Athena Distinguished Professor of Breast Cancer Research, the Associate Dean for Translational Health Sciences at the University of Washington, Professor of Medicine and Adjunct Professor of Pathology and Obstetrics and Gynecology, and a member of the Fred Hutchinson Cancer Research Center. She is and thankfully supported us in our work in doing outreach in the community. She has a much longer bio. She deserves all the recognition, and I'm really glad she's here to tell us a few words about the ITHS. So with that, I'll stop, and Gino.
Thank you, Leo. Good morning, everyone. Good morning. Bienvenidos a todos. Welcome to our liquid sunshine. In January of 2013, Dr. Leo Morales gathered several faculty members at the University of Washington with community leaders to discuss the inclination of submitting a grant to host this Latino conference on physical health. At that time, the aim was to bring together individuals committed to Latino populations, including Latino researchers, practitioners, policymakers, physicians, executive directors of community organizations, government agency representatives, and healthcare organization representatives across the region to engage in discussion about the needs of the Latino population. A central outcome of the Envision Conference was to consider to take the next step. After talking about issues and needs and research, would we be inclined to actually establish a research center focusing on Latino health? We are here this morning as a result of Leo's vision and commitment to promote Latino health and wellness. And I think it's most fitting that we take the time to recognize Leo for his stellar leadership and contribution. In March 2013, I was invited by the deans of the schools of social work and the graduate school to consider establishing a research center at the University of Washington, which would focus on Latinos. I was hesitant. I did not want more work. I had just learned that I would be appointed Associate Dean of the Graduate School to promote diversity and inclusion beginning in September. But I knew that the time and the opportunity was now. With initial seed money provided by social work and the graduate school, I asked Leo if he would co-direct the center with me. He enthusiastically said yes. So we have been planning, preparing, meeting, and building the foundation of the Latino Center for Health. So our conference today and tomorrow has added meaning and value. The breakout sessions, the network, and activities of the conference are geared to help inform the agenda of the new research center. And this interdisciplinary center has 5 foci across the lifespan of physical health, behavioral health, occupational health, violence prevention, and binational collaborations. But key to the success of the center is you. Building meaningful, authentic partnerships with you. In teaching my students, I challenge them. We need to do it different, and we need to do it better. And I seek to equip them with the requisite skills to be exemplary practitioners. The Latino Center for Health seeks to conduct research different and to do it better by not replicating the traditional paradigm top-down approach that is so oppressive, gathering data without much benefit for the organization or the residents of the community. Basta ya. At its core, the Latino Center for Health seeks to do 2 things well: to listen well and to take impactful action. The activities of the center include listening to the strengths of our people and our community organizations, listening to the cries of our youth who are disproportionately represented in our juvenile justice systems, listening to the fears of Latina mothers who are afraid to approach a clinic to obtain prenatal care for their child to be born due to their own undocumented status, listening to the consuming sadness and weight of a heart burdened by depression, listening to the apprehension of students, Latino students in graduate school who doubt their own abilities and struggle due in part to the lack of available training and mentorship opportunities because there are too few Latino faculty. Listening to the frustration of community organizations that are told to implement evidence-based practices while having their own experiences and expertise and cultural responsiveness delegitimized. But the center is more than just about listening. It is also about walking with and taking action in partnership with the community. The Latino Center for Health is committed to take action and make positive and sustained changes through the activities in interrelated areas of research, practice, and policy. Today, at our dinner reception at the UW Tower, we will celebrate the historic establishment of the center. And I and Leo are elated to celebrate this new beginning with you. Muchísimas gracias.
Hi, my name is Nora Disis, and I work in the Institute of Translational Health Sciences with Leo. The ITHS is an NIH-funded center whose mission it is to really bring research into practice. A lot of times you'll talk to researchers and you'll say, what is it that you do? And they get into some complicated explanation that no one can understand. And oftentimes people say, well, explain it to me like you'd explain it to your grandma. And all of a sudden the researcher will look at you and think about it and not be able to explain it to their grandma. And we understand that over the years, research has been disconnected from what people want for their health. Researchers should be working on, especially in the biomedical field, ways to improve human health. And the only way that can really happen is if we stop looking at research as something that goes on over there. Everyone in this room helps pay our salary because most researchers at major institutions are paid a lot by the government. And when I talk to people, I say, that means that we work for you. We're your employees. If we're not doing something that's meaningful to you, you should do something about it. And so a lot of people have done something about it. They've started getting very involved in research going on at major academic institutions. They're beginning to come to researchers and say, why are you doing something I don't understand? Why can't you be doing something that at the end of the day is going to make a tremendous difference, not only to me, but to my kids, to my parents? And that's the role of the Institute of Translational Health Sciences, to make sure that the research that's being done is something that at the end of the day, we can explain to our grandmother, and we can, at the end of our research careers, say, I did that, and that made a difference. Research in biomedical health sciences is all about making a difference to everyone's health. And the only way that we can do that is to bring the community into research as researchers. We talk about citizen scientists. We're really looking to build that here at the University of Washington and many other of the institutions that we work with, to really make research part of a continuum that may start with a great idea by a person, whether that person is here working in a research lab or whether that person is one of you. Make the connection of that idea into a group of people interested in taking that idea forward and making sure that idea goes through the whole continuum from just an idea to something at the end of the day we can end up with and say, we all did that and that made a difference. So what I'd like to end with is a charge. And the charge is join us. Join the center, join the Institute of Translational Health Sciences, get involved. We want you. We want you to become researchers. We want you to become discoverers. We want to bring you into the fold so we can create impactful ideas for the Latino community, the largest growing community in our region, and really make a difference. We can only do that with not only your partnership, but you're joining us in this endeavor. And now that we have Gino and Leo making sure that this happens,